All right. Hello, everyone. Thanks for joining us today for our HIV counseling and testing programs information session. I'm Tony Bridges, one of the assistant directors with SOURCE. We do this information session sort of before we open up the app, most of the time before we open up the applications for our HIV testing and counseling program. This year was slightly different, only because we hadn't done the program in 2 years, actually since the pandemic. And so as we've tried to reinvigorate the program, get things started again, we've changed things slightly and modified the schedule, which I'm going to talk about. But this is one of our most popular programs. And we want to make sure that we were able to at least once again offer this program in person if our partners were willing to do it, and that we had the guidance from from Johns Hopkins University. And so now that we have the guidance, now that we have our partners and our trainers, we're ready to once again get started. And so I'm glad that you all are here. Again, I'm Tony Bridges with SOURCE. We're the Community Engagement and Service Learning Center for Johns Hopkins. We work with all of our professional schools, public health, nursing, and medicine. And now our office is back open again. And so you can always stop by to see us in suite W1600 in the Wolf Street. I am not going to get into all the benefits of working with a community-based organization, because obviously you're here because you know what those benefits are and you're ready to get to working with at least 3 of our community-based partners. SOURCE, we work with over 100 community-based organizations, primarily in the East Baltimore community, but they do things all over Baltimore City. And in working with them, we want to make sure that we are putting you together with some really good partners who can help you see the benefits of the work that you do in the communities. You get to apply theory to practice. You're assisting with some of our understaffed nonprofits. But the most important thing on here that I wanted to at least bring to your attention is that you truly do make a difference. If you can't tell from my the way that I speak, I am an unapologetic Baltimorean. I love Baltimore City, everything that's going on in the city, and I'm always going to be a cheerleader for our city. And I can tell you, in working with these nonprofits and many nonprofits over the years, you truly do make a difference when you decide to commit and work with these organizations. With SOURCE, we were really selective about the organizations, and always are selective about the organizations that we bring on, because we know you have a limited amount of time to be here to do the work that you're doing in your programs. And so we want to make sure that you have a really good experience. And so the organizations that we bring on board, we put through a process where there's even an application to be a partner with community-based organizations through Johns Hopkins SOURCE. And so the partners that you see here are our partners that are doing really good work, and it's time for you to be able to work with them at least through this program. As I mentioned earlier, this is a really tight timeline. This is a little different from the way that we've done it in the past. But as you know, applications open this week. The due date is November 1st. That's Monday at 11:59 p.m. And so you have until then to put your applications together. November 5th is when we are actually going to do our final selections from everyone that submitted applications. Again, this is one of our most competitive applications. We only have 30 slots. And last year, or the last time we did it, I believe we had over 150 people to put in the applications. So again, this is a really competitive application for just 3 organizations, where it's going to be 10 people per organization. And so November 5th, we will have your selections completed. During the week of November 8th, you'll be contacted and confirmed for your participation, because November 13th is actually the training date. Previously, we've done 2 days of training. The state has actually condensed the training into 1 day. So you'll get 1 full day of training. You have to be there the entire time. And when I say there, this is actually going to be virtual. So it makes it a little bit easier for you. But you have to be virtual, listening, your cameras on the entire time to make sure that you understand what you're going through for the certification. In order to actually participate, if anybody, this is one question that I know I've seen already, you have to be in Baltimore City. Our organizations are in Baltimore City. You're going to be working with those organizations. And so in order to participate, you have to be present in Baltimore City for that participation. And then December, after your training, maybe late November, depending on our partners and our partner sites, then that's when you'll be able to begin at each of those sites. So again, we're going to take questions at the end. Feel free to start adding those in the chat so that as we see those questions, if we want to answer them during the presentation, we can. But we're going to try and take as many questions at the end as possible. Again, for the program, you will have 1 day of training. This is a full day on November 13th, all virtual. So the first part is from 9 to 12. You get an hour lunch break, and then the second half will be 1 to 4, all Eastern Standard Time. So you can do this from anywhere virtually for at least the training portion of the program, but you have to be able to be there the entire day virtually for that training portion of the program. If you cannot be there for the entire time period, you should not apply for the program. And if you're accepted, you'll be required to pay $10 in order to participate. That's just part of offsetting the costs for the program to actually run. Again, we've got 3 great community-based partners that we work with that you'll all hear from today. That's the Johns Hopkins Emergency Department, Harriet Lane Clinic, and Baltimore Crisis Response, Inc. Each one of these organizations requires at least a shift. There's 2 shifts per month for BCRI, Baltimore Crisis Response, Inc., and 1 shift per week for the other 2. Shifts typically are 4-hour time slots. And so keep that in mind when you're thinking about doing these shifts. You can do different shifts at different times, and our partners will talk about those times. The other thing that I didn't mention is that there'll be a lead at each one of these sites. That lead coordinator will be one of our students who will also help with identifying time slots and making sure that people know what time slots that they have. And they'll sort of be our lead coordinator, so to speak, for each one of these, our community-based organizations. And so if you're interested in that, also, I would note that in your application. So at this point, I'd like to give our partners an opportunity to speak about their programs, the need for their programs, and what they do, and why you should be involved in each one of those programs. The first one I'll start with is our Johns Hopkins Emergency Department, and I'll shut up and stop talking right now, and Alexis, I know, is on. I'll allow Alexis to introduce herself and talk about Johns Hopkins Emergency Department.
Hi, everyone. Thank you, Tony. I am relatively new to the Johns Hopkins Emergency Department. I have been with the team since mid-May, and I still feel like I don't fully know what I'm doing. But I have been at Johns Hopkins for the past 4 years in psychiatry, and then recently started working in emergency department. And I am supervising the HIV and hepatitis C testing team, and there's so many moving parts. This is part of the emergency department, obviously, and so whenever a patient comes in, they are offered testing to receive either HIV or hepatitis C testing, and if they say yes, then we have the opportunity to provide really quick point-of-care tests via oral swabs for HIV, or finger prick tests, which can tell a person or the patient if they've tested positive or negative, all within like 20 minutes. And if the patient tests positive, we always do a confirmatory blood test afterwards, but it's pretty straightforward. And we work really closely with the Baltimore City Health Department and the Maryland Department of Health. And we also link the patients to care and track them throughout their appointments to see if they've been attending their appointments, if they have been positive for hepatitis C or HIV. And it's a really important program because we get to see a lot of patients that wouldn't be tested otherwise if they had not come into the emergency department. And it's a special population in that none of the patients there have really planned their visit to go to the emergency department. And so you really get to see the patients when they're not doing super well, but your presence is really helpful. And if we can identify if they're even at risk for being positive for HIV or hepatitis C, we can link them to care if they're not positive. And so I think it's a really important program. And yeah, thus far we've completed around 500 point of care tests. And point of care tests are the brief tests and blood-based tests we also do on our patients. We don't actually do the blood draws ourselves, but we also have that option. We've conducted, I believe, around like 3,000 this year. So it's a really good program. And yeah, our shifts run from, we always have someone there in the emergency department Monday through Friday, 8 a.m. to 10 p.m., but it's pretty flexible. And we also have someone there on the weekends, 12 p.m. to 8 p.m., again, pretty flexible. And the team we work with is really great. We also are involved in risk prevention, like I mentioned, like PrEP, which is a medication that one can take to help prevent getting HIV. And so we also provide resources for that. And yeah, that's pretty much the gist of it. Let me know if you have any questions. I'm here via email, or just feel free to call me. I'm happy to answer any questions.
Thank you very much. So again, Johns Hopkins Emergency Department is one of our departments where, since the beginning of the program, they've been one of our partners. And so, you know, you've got 3 different organizations that you could possibly be a volunteer for, and Johns Hopkins Emergency Department is just one of our great partners. And so thank you, Alexis, for talking about the emergency department. I think now I'm going to turn it over to Aubrey to talk about the Harriet Lane Clinic.
I appreciate it. Thank you. Hey, everyone. My name is Aubrey Alvarenga. I'm a sexual health navigator at the Johns Hopkins Harriet Lane Clinic. I'm going to be involved with supporting the training that will be done for the SOURCE students that comes in, and so I'll talk a little bit about just what the counseling looks like and what that training might look like, and then pass it over to Christopher Reed, who can tell you a little bit more about just the types of shifts we have and the more the programmatic part of it. So Harriet Lane Clinic, that is the Rubenstein building, which is on Wolf Street, right next to the CVS. It's a clinic focused on youth. It's a pediatric clinic and young adult and adolescent clinic from ages 0 to 25. There's a wide range of people we see for different services, anywhere from HIV care, PrEP care, gender care. There's a continuity clinic, just general pediatrics, and acute side as well. And so we offer testing and for HIV, because just since the pandemic, there's been a shortage of testers. So there's myself, Chris, and a few people that have been coming by. So this is a huge opportunity and huge help to us to have SOURCE students come in and increase our testing capacity. If you've ever been involved with HIV care in the past, you know it isn't just testing in a clinic. That's not what's going to end the HIV epidemic. So this includes, there's more to it. So counseling, of course, we do health educate. We'll do training in health education and risk reduction counseling, which includes PrEP, pregnancy contraception, and a whole bunch of other stuff. We also have volunteers that we work closely with. They used to be called health leads, and now they're called community connections, where they connect people with a whole bunch of different services, anywhere from food, housing, health insurance if someone's not insured. There's opportunities to get involved with community health events. We're targeting youth specifically for the testing, specifically ages 13 through 25. And so a lot of times this involves outreach events, whether they're virtual events, sometimes they're virtual balls. If you know the house ball scene, there's sometimes tabling. We've gone out to parks before and done different things. And so sometimes during our counseling, we've identified some needs that youth have. Sometimes people want to get back into school, apply for jobs, get a resume going. And so we've been able to create workshops based on the needs that we see in clinic. And so you as a potential counselor, I can identify some of that and be involved with some of the outreach that way. And so part of the training will involve some different shifts throughout, and where you will learn some different tactics to address youth. We're looking for people, and of course there's going to be a lot of training involved, but also you would be a good fit here if you've connected with youth before. You could bring some positive, good and energy. That's what I think you come in, and they're used to seeing, some of the older doctors, come in. And so sometimes I think they feel like it's refreshing to get someone with energy to come in and just be like, here's the lowdown. Feel comfortable talking about sex, talk about, the ex-girlfriend or boyfriend, and really just make it a real conversation. I think, one difference I noticed with the emergency department too, where the emergency department people are coming in, they're not expecting to come in. This is maybe a one-time thing. In this clinic, we're seeing people over time. So a lot of times they're patients that have already been here before, who have already established relationships, or we will see again. And so that ongoing relationship is really important here to keep youth engaged and coming back. So that's a little bit about the program. There's a lot more if you're interested in prevention. We also do PrEP navigation. We have resources to provide some people transportation to their appointments, and a lot of other resources. So it would be a huge help, and also very important work in the community. So I'll turn it over to Chris, who can tell us a little bit more about the scheduling and how the training kind of takes place.
All right. So hello, everybody. I am Christopher Reed. I'm with the Harriet Lane Clinic. So pretty much what we offer at the clinic for as far as shifting is concerned, shifts will be from 1 to about 4:30. And that will be downstairs in the Harriet Lane Clinic in our adolescent side. During the training, before we go downstairs and everything, during the training, we'll go over like some PowerPoint things and go over like gender particular things, as well as, just how the clinic's outline is as well. And with our clinic, we do have a lot of other things as far as like gender clinic is concerned, substance use. There's a lot of research opportunities inside of our clinic. So if you are interested in any of those things, you are more than welcome to talk to any of the providers, to ask any questions that you like, to be a part of those programs, or, just to kind of shadow providers. Our SOURCE students in the past have shadowed a lot of the providers and the research assistants in order to get a better understanding of what they're interested in, because there are a lot of things in the clinic that possibly may interest you outside of our risk reduction and HIV testing. What else? One thing with our SOURCE program, us being a SOURCE site, is that we try to encourage independence. So with that being said, we may have someone who may be that point person for the SOURCE students when we are on campus with our facility. So that would be someone who's in charge of pretty much just making sure that the books look right, as far as who's coming in, what patients are coming in, who needs this type of testing, who needs this, who needs that, so that one kind of gives you that kind of coordinator type of situation for yourself, to let you know that, hey, I was the one running and assisting with the SOURCE students that were there. And as well, I think am I missing anything? I think that's about it. More or less, just we kind of covered everything else. But again, if you are interested in anything other than the risk reduction program and the HIV care, there are definitely plenty of opportunities for you to explore everything in our clinic.
Great. Thanks, Chris and Aubrey, for talking about everything with the Harriet Lane Clinic. Obviously, there are some differences between some of our community-based sites. And so as you're listening to this, keep in mind those differences. And so if you hear something that piques your interest about a particular site, you should definitely talk about that in the application once you get to the application process. And so last but not least, we also have one of our great partners, Baltimore Crisis Response, Inc., and I'll let Jasmine talk about her program.
Hi, everyone. My name is Jasmine. So Baltimore Crisis Response itself is just pretty much a crisis center overall. They offer a 24-hour, 7 days a week, 365 days crisis care for anybody who needs it anywhere in Baltimore City. We typically serve Baltimore City residents, but lately we have been venturing out into the many counties to provide mental health services for the residents. So not only do we have a mobile crisis team, we have units within the crisis center. One of them is a detoxification unit, and one of them is an actual mental health crisis unit where the clients can stay to up to 21 days to get the services that they need. I currently work in the Allied department, which is a smaller branch to BCRI when you look at BCRI as a whole, but it's the HIV and hepatitis C department of the program. We're not a clinic like everyone else. I hear everyone else saying like, hey, I'm a clinic. Like, yeah, no, we're not a clinic at all, but we do provide HIV and hep C testing, linkage to care. We do educational groups. What else do? We do a lot of hands-on work. It's not necessarily like, inside of a center. Someone who would want to come and do HIV screening and hep C screening with us would have to be someone that's comfortable within the community that we service, because we do a whole lot of community work. We typically see a lot of clients that fall through the cracks, like people that haven't been in, care for anything for years, because we're meeting them at homeless shelters, and we're targeting street workers and just a whole bunch of different populations that we're focusing on, trying to pretty much link them to care or either decrease and suppress viral load suppression. Like, we're just trying to get people knowledge and basically the support that they need to pretty much get into care. Because it's easy for us to say like, hey, well, maybe you're HIV positive or you're hep C positive, but a lot of people don't have the support systems that they need to actually go out and get themselves treatment. Hep C screening was a really big deal for us a couple of years ago, especially since at first they weren't allowing people, depending on what your viral load was, to get treated for hep C. So we had run into a whole lot of clients who had hep C, but because their levels weren't high enough, they weren't treating. So, anybody who's tested for hep C, they know as of 2021, anybody who had came in contact or actually has the virus was able to get care for it. So I think that's a great thing, because dealing with the population that we deal with, we run into a lot of people who are hep C positive, and quite frankly, they don't even really understand what that means. And some of them, they have been told that they have a positive antibody for hep C, which doesn't necessarily mean that they have hep C, but it hasn't been explained to them. So I think that what we do here is a great service for the community, because we provide not only testing, but just education and support as well. As far as the hours, we're in this department, we're here Monday through Friday, pretty much 7 to 4. It's very flexible. As far as your schedule goes, right now, due to COVID, we haven't really been back out into the world like we usually are, but we are here testing on the units, and we do have a few other organizations that we do go to. Whenever those opportunities present themselves, other than, when we test regularly on the units, we'll make that available, and we'll let you know what time it is, and pretty much you let us know whether or not if that time works for you and if you are available. So pretty much that is the gist of it. We do PrEP education as well. It's almost just like sexual education, period. We touch based on anything and everything, even though our main focus is HIV and hep C, we focus on other STI infections as well. We work closely with Baltimore City Health Department too. They come and they provide a service to us, providing STD screening for like chlamydia and gonorrhea for our clients. It's just a whole host of just making people knowledgeable and trying to keep themselves safe. So if you're looking for that type of adventure, come on over here to BCRI. I would love to have you. And that's just it. And if you have any questions, I'm available by email, telephone, however you want to contact me, and we can discuss it better then.
Awesome. Thank you so very much, Jasmine and BCRI. As Jasmine said, if that's something that you're interested in, definitely keep that in mind as you're going through the application and the process, because each one of these organizations, although they do have a very similar focus, they do have differences between those sites. And, just wanted to highlight some of the differences between each one of these sites. And so, you've got the hospital and the clinic that are both the hospital at least isn't a hospital. It's an emergency department, where the clinic is just that, a primary care clinic that directly deals with youth. While Baltimore's BCRI is different from the others, right? You're out in the community, you're doing on-site testing, or you're doing testing within the organization. And so each one have some slight differences in what they do and how they do it. And so I just wanted to sort of highlight some of those differences for you, even when you're talking about the shifts, right? And so, like Jasmine said, they're a little bit flexible with their shifts, especially those 5 days out of the week, where the hospital may just have those shifts, again, 7 days out of the week, from 8 a.m. to 12 a.m. But Harriet Lane Clinic is a little different, because they have mostly afternoon shifts, beginning from 1, I think, until 4. And I believe that maybe some morning shifts as well, but everyone is a little bit flexible in terms of the way that they do their availability. And so just wanted to make sure that you were taking note of some of those differences and highlighting those differences, because as you fill out the application, these are some of the things that you need to keep in mind for the sites that you would like to be at as we get the process started. Just some additional information. I'm sorry, Jasmine, you wanted to say something?
I'm sorry, it's so tricky on here. I don't know whether to raise my hand or what, but I just wanted to say that people who are looking for like a clinic feel, even though we're not a clinic, we do work with like the federally qualified community-based health centers. So it's not directly here, but we travel there, they travel with us, and you'll still get that type of feel, but it's just not in a clinic. Okay, I just wanted to make sure that everybody understood that. I didn't want them to think like, well, I don't want to go to a crisis center.
Right. No, okay. Thank you for pointing that out. Definitely appreciate that. Good clarification. Just a little bit of additional information. Even though we do the certification during one day on the 13th, there are still some site-specific trainings that you'll have to do for each of these organizations. Everybody does things a little differently, and although we try to incorporate as much as we can in that one-day training, there still may be some site-specific training that you'll have to do. As one of the participants in the program, you have to participate in a quarterly reflection session. Everything we do, especially with the service learning pedagogy, we always try to incorporate some form of reflection. And so just keep in mind that you will have to do some reflection throughout the time that you're participating in the program. There may be an opportunity to continue into the summer and the future. That's really up to the organizations if they would like for you to continue. And if there's an opportunity for you to continue with them, then you should definitely work with them on figuring out what that schedule may look like in the future. I already mentioned that there are some student site leaders that we try to put at each one of these sites. And those student site leaders are really the go-to people for us. These are the people that if there are any sort of issues in terms of scheduling or, contacting individuals, things like that, we rely on some of our students to be those site leaders for each one of the organizations. And so if you are interested in being a site leader and helping us with that scheduling, and working with the rest of your team at that specific site, you should also put that into the application. And scheduling, like I mentioned, the student site leader would additionally help us with the scheduling for the program for everyone that's at a specific location. In terms of the application, as I mentioned, and I've been talking about this throughout the time that we've heard these presentations, select the sites that you're comfortable with and interested in working with, right? And so you've listened to all of our specific sites. You know what they do, you know, the population that they work with, how they work with that population. If there's anything that piqued your interest, you should definitely note that in your application. This is a very highly competitive opportunity. We, as I mentioned, had over 150 people apply the last time that we actually held this program, and we only had availability for 30. At that time, it was 35 people. This time, there are only 30 people, and so that means it's even more competitive. And so the more that you put into the application in terms of why you're willing to do this, you know, a little bit about your background, and just your willingness to work with these organizations will go a long way in your application. There's a panel that actually reviews the applications that includes our community partners. And so we send that information to our community partners, and then we have a sort of a selection process that solely depends on your written application and nothing else. And so, you know, keep that application in mind, keep the community-based organizations in mind as you're filling out that application. Because we are so competitive and there are so many people that normally apply, we don't normally give feedback on why candidates were or were not chosen. We do give you feedback that you weren't chosen, or at least let you know that you weren't chosen, but we cannot give you everybody feedback on why you were or were not chosen or selected for this opportunity. But I will let you know that there will be other opportunities in the future to participate in other programs. And even in the email that we send back letting you know that you weren't able to participate at this time, we do let you know about alternate opportunities to participate in other activities throughout the year. There will be alternates that are identified in this process. We know that sometimes things happen. You may have all the intentions in the world of being a part of the process and the program, and then something happens. And so alternates will have an opportunity to actually participate in programs if people, you know, decide at the last minute that they don't want to participate anymore, or things happen. Again, this is a fully in-person opportunity. And so if you're not willing to be in person for these activities, for these organizations, please do not apply. We don't want to waste your time, and we don't want to waste our organization's time as well. So just some information to keep in the back of mind as you're completing the application. And again, the deadline is Monday, November 1st. This is a very competitive process and a very short timeline. Now, I apologize, but part of the reason is we got the guidance late that we were able to actually have this program up and running. And we, because we got the guidance so late, we had to sort of condense that timeline to make sure that we can at least give you what we hope to be a full academic year, but really is turning out to not be a full academic year, but we want to get you as much opportunity as possible to be able to participate with our programs. And so Monday, November 1st is the deadline. If you go to SOURCE.jhu.edu/HIV, you'll find out all the information. We'll even have this recording posted so that you can go back and listen to it again if you have any questions about the program. And you can always reach out to us at SOURCE.jhu.edu if you have any specific questions about the program or the application and the process. Stay connected to us. Make sure you're subscribed to SOURCE. Look at it, like us on all of our social media. And again, if you want to have a one-on-one meeting to talk about anything that you've heard today, email us at source@jhu.edu, and we'll be sure to get together with you or answer you by email in regard to your questions that you may have today. So with that, is there anyone who does have any other questions about or to any of our programs about anything that you're hearing today? You can either put it in the chat or I think we have a little bit of not many folks. If you want to just take yourself off of mute and ask a question, you can do that as well.
Hello, I have a quick question. So I was wondering if I was selected to participate and I already have the HIV counseling testing certification, would that surpass the training and $10 fee, or would I have to get trained in Baltimore again? When did you
last do the training or get the certification?
It's still active. I was recertified in February, I believe. Oh, no, actually it was May.
Okay, we have not had that come up before. Let me just check in with our trainers, because I'm not sure if they have anything different, especially if you did the certification already. You may not have to do the training, but you will have to get selected. And so what I would say is make sure that you still fill out that application, so that, you know, we know exactly what organization you would like to be with, why you're still doing it. And we can always just go back to check to see if you're still required to do our certification, or if the certification that you already have, which I would assume is still in good standing, we could just move forward with that. You will still be required, however, to do the $10 fee, because that's just part of what we charge to have participation in the program.
Okay,
Good question. Thanks for asking that.
Thanks.
Anyone else? Just note that, you know, previous experience in HIV isn't necessarily required to apply for this opportunity. You know, if you have that experience, great, definitely highlight it, but you don't have to have that experience. I think you need to have the willingness, you know, and just highlight why you're so interested in actually participating in the program. Because again, this is an application process. We want to see as much written out about your goals of participation in the program as possible. And so that work experience, although it should be noted, isn't the end all be all to why you should be selected for the program. Let me see. In the chat, it looks like we do have a couple of questions coming in. In regards to the weekly shift requirement, would there be any leniency during the holidays? In the event we would be out of town for a week? I'll just blanket say, you know, all of our organizations are pretty nimble, and communication is always key. And so if you are going to be out for any amount of time and shifts can't be covered, I think communicating with the organizations to let them know what that time is going to be would be really key. You know, and trying to do that as much ahead of time as you possibly can. We realize that things happen. Holidays, although, you know, and it's up to each organization, although they may have opportunities available during the holidays, it's not required that you work during the holidays. And so I think it's up to each organization. If you have that willingness and you want to work during the holidays, then, you know, by all means, I would reach out to the community partner that you're assigned to see if they have an opportunity for you, but it's not required that you work during the holidays. Does the volunteer start date coincide with Christmas holidays? It should not. However, it's up to each one of our organizations, right? And so once you are selected, you're going to work with the organizations. We actually have somebody at Source that's going to work with you as well to get you all established with the organizations. But once we're with the organizations, you all sort of handle your schedule and figure out what those times should be for when you actually start. We had a tentative date of December only because we know that after November 13th, we also have other holidays that are coming up. Thanksgiving is right around the corner. And so, you know, it's really up to our partner organizations to set that start date. But we set a tentative start date of December because it's after November 13th when you actually have your certification done.
Yeah, and Tony, for us at Harriet Lane, we go by university rules. So if the university is out on any holiday, we're not required to come in unless you are, of course, a MD or essential staff. Sorry.
Thank you. I don't think. Oh, okay. I don't think I missed any other chat questions. If I did, feel free to speak up now. Unmute yourself. Because if not, I am a true believer in giving people back time if they don't need to take the entire hour, because we all have lives and things that we need to do as well. And so if that is the case, feel free to email us once again, SOURCE.jhu.edu, if you have any questions at all about the program, about the application, about the process. Let us know, and we'll be happy to get back to you and get you the information. I just want to thank our presenters once again from Harriet Lane Clinic, the Emergency Department, MVCRI, for being a great partner as always, and for your participation in the program. And if anybody doesn't have any more questions, thank you all. This is going to be recorded and posted, so you can always go back and check it out. But good luck in filling out the applications. We look forward to seeing them and getting you started and involved in the programs. All right. Thank you all.
Thank you. Bye.
Have a good one.